Good morning, everyone. Welcome to our second Zoom session, spreading the awareness of bystander CPRs. Good morning to those who are on the west side of Atlantic. Good afternoon for Europe and Africa and the Middle East. Good evening for our Indian subcontinent audiences. And finally, I must say literally very late good evening for the Australian Med School, James Cook University, who are again a band of young students trying to join very late from them. As you all have seen by this time that we are trying to spread this concept of bystander CPR through many live sessions. And I'm very excited to see that particularly in this session, people are joining from different parts. We'll be waiting to see. And I'm very excited to also see that many large groups are joining today. And I'll try to find the names of the groups and we'll mention for updates. We are starting with one of the videos. So please watch this. Hello everyone, welcome to our Bystander CPR awareness program organized on this special occasion of World Restart a Heart Day that is now being promoted by many world bodies over the last 6 years. Encouraged by Heart and Stroke Foundation Canada, well supported by several of our McMaster faculties, some of my good friends, our CPR global team, and all of you organizers around the world, we wanted to spread the concept of bystander CPR with particular attention to Asia, Africa, Central and South Americas. You will be pleased to know that today we are connected to all the continents except Antarctica. I'm very sure everyone in Antarctica is very well equipped with advanced resuscitation skills. To cover different time zones, we are running this program multiple times today. Following a request from our world partners, we decided to pre-record this session on multiple languages. In this first half of the session, we also recorded a few questions and answers as we saw from our previous programs. After the first half, we'll have a 5 minutes break, and I'll request all of you then to take an opportunity to practice hands-on chest compressions. We tried to send mannequins to many parts of the world, but I'm equally aware that some of your centers probably do not have mannequins readily available to you. Those of you who do not have an access to mannequins, you may consider practicing this on an air pillow to get a feel of the scenario and posture. We also tried to pre-train the trainers for a few centers. I'll request all of you, those who have practiced this before, please feel free to train others and check for appropriate posture, rate and depth, and we'll learn this simple technique together. During the second half, we'll be live and all the sites will be open to question and answer session. We may try to ask simple questions for better audience participation. Hope you enjoy the session and feel free to give a feedback of your experience today, and please comment on how we can do better together in the future. So let us talk today about this very simple and effective tool which we have gone. Let me go back on the first slide here. So bystander CPR, a concept, is very well known to most of you, I suppose, by this time. It is an excellent tool, simple yet very effective, and you need to do this during emergency. Let's learn it together. A concept we talked about CPR begins at home a few years ago. Then what I meant by this simple concept that this has its use at home for the seniors, for the elderly, for our grandpas, for our colleagues, But as you start from home, during commute, on your way to your work, to your job, to your institutions, to your office, and then finally at your workplace, you have to use it. But I didn't realize at that time that concept of begins at home. It's so literally now CPR is beginning at home, as most of us, we are even learning CPR at home. Any of you know what picture I'm showing? I'm sure you possibly recognize this gentleman from the ancient time of Greece. The name Marathon came from this perfect runner. This is a statue of Philides, the Greek soldier who ran 26 miles from Marathon to Athens to announce the Greek victory. And very unfortunately, he could not complete his whole sentence before he just said that we own, and he died after giving this victory news. But what was missing in the ancient Olympics? There was no CPR. People didn't know about it. The concept was totally missing not long ago. Possibly 5 decades ago, we didn't know about this. Let's share this video for all of you. I'm sure with your avid interest in soccer, many of you are watching this event live with Danish team player, and the team was playing with Finland. Watch this minute carefully. Watch the hero of the Danish team. Just it is coming soon. So people are still, everything is so far. Watch him. Watch him. It looks well until now. And now this unfortunate event, we're talking about Christian Eriksen. So during that game, this young man, who obviously was one of the best in the country and possibly one of the arguably big player in the world, fell down on the ground. He was still healthy when he joined the match. He was healthy. Of course, before that he was healthy, but something happened, and that's the essence and crux of the today's talk. If we start with the story, the big and most important problem is that even an ex-athlete who is excellent until possibly minutes ago, of course, when whatever test was being done, and in COVID time, he must have got COVID test before coming on the ground. And so far we knew that he did not contract COVID, at least recently, or the tests were negative, and he fell down. But what saved Christian Eriksen's life is the advanced CPR. By the evening, he's tweeting, talking to his friends and fans across the world. People cheered him when he left the team. By that time, he was leaving the ground. Even though on stretcher, he was conscious, luckily. But what saved him? CPR. So that's the most important thing. And you will remember, even though the doctors were there, very advanced, skilled professionals were there to save his life, but it is very, very important. The first maneuver started by his teammates, and who are there are not the doctors, are the onlookers. People were present at the scene of the victim. They started doing this simple maneuver of chest compression. And as you see in this picture here, that this simple thing, we'll learn it today, how this could be an essential part of his life, of all of your lives, of all of our lives, and you will be hero one day. You don't know when this will happen. It will be, of course, unforeseen in most situations. You will not expect what it will happen, but this is a skill which will carry throughout our life, at least to use it sometime during an emergency, an unintended, unexpected situation, be it at home, be it at your work, be it at commute, or in an airport. And we are hearing more and more stories of success stories of how CPR saving lives. While we talk on this, just let's, this is one of our Hamilton skyline here. I come from McMaster, located at Hamilton, and the onlooking is the Lake Ontario here. So over the last few years, when we are talking about in Ontario's Wonderland, Heart and Stroke Foundation once made and tried to encourage this concept of bystander CPR, chest compression only CPR. We'll talk today primarily on that. CPR has its many nuances, many complexities, but we will talk about the simplest form, what is most important during the onset of the cardiac arrest. So what I learned on the day when I went to Wonderland, that basically the school students were interested, and I took my son there, and he was at grade 8 at the time. And then I was realizing what a nice concept coming from the heart and stroke in the world. Bodies trying to resuscitate, that it should be part of each of us as early as our early student life. But unfortunately, in many parts of the world, even when we were young adult or possibly getting older, we did not have an opportunity to learn this simple maneuver. Now, imagine a scenario either at your workplace, commute, or at home. Someone who either talking to you or working on their own suddenly falls down. The most important thing at this time is to go to that person and checking for response. You can do it simply saying, "Are you all right?" And then you can gently shake around the shoulders. You may have to give sometimes a little bit more painful stimuli like rubbing on the center of the chest. You may have to use your knuckles. And if during that time that person responds either by raising hand, trying to say something, or moving limbs, then you know that this person does not need CPR. This person might have fallen down for what we commonly call as simple fainting. We may discuss more about that simple fainting, but what is more important now, this person does not need CPR. We do not need chest compressions. This is called a recovery position. For some reason, someone is not feeling well, fell down, became dizzy, became a bit unconscious, but then patient started responding nicely, patient moving limbs. We do not need to go for CPR. Put the patient in a recovery position. You may gently loosen the shirts and just making the unbuttoning the pants so that he feels a little relaxed. We do not need chest compression, but for any reason, person does not have pulse, or in doubt, remember this part, or in doubt, you do not need to take a chance. Do not wait. Just call for help if you are alone and just immediately try to give chest compressions. We'll talk more that mouth-to-mouth breathing, which was considered an essential component, but especially when you're talking about the playground, when you're talking about the healthy people, those who are on the field, those who are running in the part of activity, mouth-to-mouth breathing may not be important. We'll also talk what are the limitations of other parts. So we are talking the most simple, the easiest one, but if we learn the skill very well, how we can give chest compressions. So we'll continue to talk a bit more about this in our video also, and the team who will be helping us today, we'll have several breakout sessions where all of you will get an opportunity to practice what to do, how to do it. So look at the posture here, how it is so important to sit next to the victim. There's no left or right. We can sit either side. If there are more than one rescuer, we can sit both sides. And then as you sit next to the victim, what you want, keeping the shoulder straight here and elbow straight here, you are trying to put most of your body weight on the victim on the very center part of the chest. Just keep it simple on the very center of the chest. You don't want to go towards tummy as it is a soft structure. And the most important part at this time, that what our heart normally is doing for us from birth to death, it is contracting, it is compressing, it is pushing the blood from the heart to the body, particularly to the brain. But in this unfortunate situation, heart stops nicely contracting. Either it is fibrillating or it's not pushing the blood. And here comes you, each of the rescuer at the scene of the victim, next to that, as we call ourselves as a bystander. There are some changes happened over the years about the resuscitation, And the councils across the world decided that actually we need to do it harder, at least going for 2 inches in depth, and faster as compressions close to 100 is the best way of giving chest compressions. Before 2010, people are talking, even if you are less than that is okay. If you are giving 1.5 to 2 inches, okay. But 2010 guidelines from American Heart Association and European Council agreed that, of course, if we can make it faster and actually deeper, even at the cost of more injuries. We'll talk about that again in question answer session probably, that the risk of injuring the ribs, the rib fractures are very common. If you are going faster and more pressure, the risk is higher for having injuries on the chest wall, particularly the ribs and the breastbone, which we call sternum. These bones often get fractured, even as high as 97% being reported. But we are aware of that. At the cost of chest injuries in the form of rib fractures, we are saving a life. So more and more we understand at this time we are not worried about injuring. We are really concerned. And to make this in your own mind, people, those who are into music, you are listening, that music's of different form, starting from any common music to a classical music where you have a beats close to 100, just hum it in the back of your mind when you are practicing. So you know that at times of chest compression, you are fast enough. And that's, we're trying to simulate it today during the hands-on sessions, that how best we can achieve close to that rate and depth. You all like evidence. You like to know more about the reviews, what has happened, and the evidence behind this concept. This particular paper, which clearly said what is the best outcome measures, we can see what are the metrics, what we know so far, observations and conclusions from several studies during resuscitation in the world, we came to know if the arrests witnessed by bystander in out of hospital cardiac arrest, the chance of survival is much higher. So out of many confounders, the most important clinical criteria being standing out is the arrest witnessed by bystander. And the next one, of course, by EMS. If there are more skilled and advanced resuscitator around, chance is good. And then the most, again, important thing is provision of bystander CPR training and volunteering. As you can imagine, you do not expect an advanced resuscitator, a skilled personnel next to the victim, whether it is happening at home or the residences or the workplace. You don't expect them to be there. So once it is witnessed by a bystander, but that bystander needs to know how to provide the CPR training. And then comes that we'll touch on the defibrillators, which is important, but each of you and us all remember, whenever there is AD, you are not bypassing these steps. You have to provide chest compressions first, and when you are preparing still and in between shocks, you still need to give bystander chest compression, and there is no alternative to that. And so that's why you are learning this basic skill. We do not need any instrument. We do not need anything with us except your knowledge, and by that knowledge, awareness improves to change your attitude, and that attitude will lead into a better practice. And to do that, practice, practice, and practice. So we will give you opportunity today. All of us try to learn together. What we have done in the last few years, we can skip these videos. It is not very important, but we tried to produce several videos in different languages, and we are continuing to do that. And we will do that more and more. Let's talk about this part before we try to disperse to different groups. I think I will try to give all of you more time to practice, and then you can go. But let's talk this one of simple thing. What stops people from doing CPR? Even those who know, and I don't have this slide with here, that even in the developed countries, including US, less than 50% actually give CPR, even though they possibly knew. Some of them even done, but not done enough, or not done in the recent past, or they are worried. So what are the fears and concerns which you as a beginner will have, and even those who are doing not so regularly but have heard about it possibly will have the concern? And one of the most important concern is mouth-to-mouth breathing. Any of you want to put in the chat box to make it a little interactive? Any of you have any of your concern, you can, and we can address that, and we'll try to come out with some solutions today. But any other concerns you would have if you being asked, you are witnessing such an event which may appear as unfortunate to you, but once you will know it, and you will fear, definitely think yourself as very proud that you have offered some help to this victim, and if you are lucky, you might save a life. So what are your concerns? You can put it in the chat box if any of you feel that if you are happen to be a part of such situation, either at your commute or workplace, or even while I was in actually IIT Bombay, one of the student came us on later that, can I tell you that when my mom was passing out and had an arrest, and my dad was next to me, and I told my dad, can I try? And he said, can you do it? And I said, yes, I can try. But then I would show it is my mom, I couldn't try it. But there are success stories that while I was actually in Jadavpur one time, I was there, but a senior lady faculty told me, can you believe I did my chest compression for the first time without any training? I said, that's great. How did you do that? And she said, my brother, who was in US, is not a doctor. When I called him, that dad is not doing well, and what can I do? And he told me over the phone how to do chest compression. So these are nice to hear, but still most people will be afraid and scared to try if you do not know. So kindly feel free to put it, and just to make it a little interactive, I was thinking if any of you feel what are your own concern would be at the time if you're not feeling comfortable. Let's move on. And the other concern, of course, as you just said, and I already answered, each of you, when you are not a physician, will be concerned with harming the person. And there is no surprise to that I'm being told by the doctors in the medical college when I go, particularly when the CPR is not so common. It's not yet a household thing for the community. So the parents and the caregivers, during the hospital, when doctors are giving, the very first thing is that I don't know what happened to my son or to my father, and then doctor started doing something and then he passed away. So that's the way, that will be the narrative from the family side, because they don't know CPR. But the harming the person is always an inherent concern when you are not a physician, that if I do it and if it happens, isn't it that? It is not people telling you only. You, being a conscientious person, you'll be worried that did I do this something wrong, what I did not intend to, or possibly I do something wrong. Answer will be coming soon, but I'm telling you, you are still doing a good justice if you do it rather than you don't do. Legal consequences. If you are on the air, if you are on the ocean, if you are not in a mainland, you don't know whose territory it is and whose law is governing you allowing this person, you possibly don't know. But we'll talk. And then you may say, I'm not good enough. Of course, fair enough, most of us are not good enough. And the final thing is physically unable. So what are the answers? Any of you want to address there before I go and tell you the answers? Any of you want to say any comments? We'll talk each of these. How do we address, and how do we already have addressed in this concept of chest compression? We are trying to avoid mouth to mouth. Of course, during COVID time, I would not suggest any of you try to do mouth to a bystander or a stranger. So let's move on quickly. So what are the solutions, so that you say that we are going for chest compressions only? And harming the persons, I answered in many different ways, but definitely you know that it is very much possible that each minute goes, chance of losing a person goes by 7 to 8% by each minute. So this is golden time. And some of you might have read when this happened with Christian, the people that his doctor clearly told that each second is important and vital to us. And no, this is not a joke. It is important. This is the time you don't look at your back. You just start doing something. Good Samaritan law prevails in most parts of the world, and including India, and where we stand in North America, both in US and Canada, and most parts of Europe, and actually both in the sea and air. And you will be very pleased to know that I attended at least now 10 times in the plane on different occasions of different patients in the air. And I'm very lucky that most of the time these are minor events, but we had to give chest compression at least once. And these are well covered. And you always think you won't perform properly. Of course, as I said, if you don't know, and there comes this Confucius, this famous saying that if you hear about it, possibly you'll forget. But if you see it, you'll possibly remember. But if you do it, You will definitely remember. And then you'll need to know, of course, you need to be very skilled as much as you can. But the question is, it is easy to do, and you give an attempt and you will do it properly. And I already told you, even a quite senior faculty lady who has never done, is not a physician, never done, but she could actually give the chest CPR completion to her own dad, even though she hasn't done ever in the life. And you may think you are unable. Of course, you always do your best and call for help. And here comes, especially for India, if you think an elder person, an elderly lady is there who cannot do it herself, but you, being an enthusiast and being a volunteer and altruistic intention of trying to give chest compression, if the crowd around you are not so helpful and charitable to you and give you a question, but if this lady comes and says, let him do what he's doing is the best thing to do at this time, don't stop him, encourage him, and if you can help him, do it. So that's equally very, very helpful. It is very, very important. Even if someone is physically unable, it is so important for them to be around to support you, to help the concept. Let's watch this simple kind of cartoon video. You will appreciate. I liked it. I'm sure you'll like. So even though the term CPR stands for cardiopulmonary resuscitation, currently you can say actually the brain is the most important and vital organ, and there are no one else unlike like you guys here that cerebral perfusion is so important. So in this cartoon, watch that. You don't need to know the details of the heart here. Basically, heart is pumping. Healthy man. Erickson is playing on the field. Heart is pumping, possibly pumping faster when you are running, but blood is going to the brain. Now, unfortunate event happened, cardiac arrest. So even though I'm saying the heart is stopped in the cartoon, but heart actually doesn't necessarily stop, it fibrillates. Watch the brain. Blood flow is not there. Here comes you. Started giving chest compressions now. Push enough, faster than this what we are showing. It is slowed down just to show, but watch the brain. Started getting blood. So your lifetime, you have done something good if you have done this. What the patients, the victims, heart was supposed to do at this time. Now you have done this. And I'm sure many of you have these questions. So specifically, I put the slide for all of you to make this distinction of heart attack versus cardiac arrest. And we'll take these questions during the question and answer session. But just talk quickly about heart attack and cardiac arrest. What is heart attack? So basically, the blood is not flowing to the heart muscles. So usually people are conscious, but quite a bit of pain in the chest, or sometimes upper body discomfort. But cardiac arrest is something more serious, and where there is some form of rhythm abnormality. Heart loses its synchronicity. So usually person is conscious and losing his consciousness by the time. So that's the big difference. Patient is not responding, and this patient doesn't have a pulse as well if you are going for it. But don't bother for pulse if the patient is unconscious, you still can give chest compression. This is a nice story I can share with here. It happened to our emerge here, and that sometime one of our physician that initially thought the patient is unconscious, not responding, and as the pulse was weak, started giving chest compression. And the person wakes up and he thinks someone is doing something on my chest. Literally, he just gave a punch to the rescuer chest there on his face and chest and say, what are you doing on my chest? But then he started smiling and said, okay, I saved your life. I'm happy you punched me, but you are alive. So don't worry about that. If you are not feeling the pulse or not sure, you still start on. Often there may not be a previous symptoms, and oftentimes cardiac arrest may be part of heart attack. Doesn't matter. You don't need to be a doctor. You don't need to go for the cause. You still boil down to simple message here. Someone who was in front of you who is now not conscious. And what do I do? Okay, so let's go. I will talk a little bit of defibrillator. At this moment, we'll keep it short. As we said, still we have to start first before we move to the next stage. When there will be more access to defibrillator, all our playgrounds, fields, and athlete meets places must have a defibrillator in place. In modern day, no stadium should have a place without a defibrillator opportunity. Ideally, there should be more than one so that it is available very close to the victim. We'll talk more, but I think this video, as the time is running, I think I'll not take too much of time, and let's make it short. We did some video here, but what I'll do, rather than running the whole video here, I'll just, here we are talking several things, but let's go and try to show a little bit of chest compression here, so that if you have identified. So it is here, two of our students, they are acting, they're enacting here, trying to save her as if on a regular day we didn't know anything. And if you are not sure what's going on, if you don't know what to do, but call for help. Luckily, most of the time, especially in India, there'll be a lot of people around, and then you think what to do there with chest compression.
Place the person on your back on a hard surface. Aim at the center of the chest, right between the two nipples. Place the heel of your hand in the middle of the chest. Then place your other hand on top, clutching the fingers. Your hand should be as shown. Lock your elbows and position your shoulders above the patient. Use your hips to deliver the compressions. Compressions should be 2 inches or 5 to 6 centimeters deep. Push hard enough to let the chest recoil. You should be compressing at roughly 100 beats per minute. To help maintain this tempo, try compressing to the song Staying Alive by the Bee Gees.
Thank you so much for such a good session, Dr. Tapas. And thank you for training me across all your sections. Thank you for giving me the bystander CPR training. Brajesh, that I said that recently we lost Yashpa. I guess we could have saved him and had someone close to him knew how to do CPR. That's absolutely right. Dr. Tapas and I have reviewed so many videos on WhatsApp of people who just are otherwise waiting in a bank line and they just collapse, and people take videos and photos, but they are not doing any CPR on them. So they take videos and photos, they don't do any CPR, and then the person passes away. Dr. Tapas said that with every passing minute, the likelihood of survival falls significantly, and therefore it is quite important to rush to action immediately. Is there a particular situation where doing a CPR can do more harm than good? I think it's important to identify what situation you should be performing a CPR in. If the person is alert, is talking to you, is just telling you my chest is hurting, you don't need to perform CPR if they are responding and if they are reactive. Usually you would perform CPR if they just, for example, otherwise seem to be healthy, maybe waiting in a line, and fell down and are not responsive. But if they've fallen down and are communicating with you, then there is no need to perform CPR on such a person. Their brain is working, they're able to communicate with you. But is there a particular situation where not doing CPR can mean that the person loses their life? So definitely CPR has more good than harm. Does CPR has any consequence? It has the consequence of saving a life when performed effectively. You have to do it the right way. That's the whole purpose of this thing. You have to do it the right way, and you have to identify the situation under which it is appropriate to do it. What are some harmful effects? They aren't necessarily harmful, but there is another question. Is there a risk of breaking the person's ribs? This came through a private message. Absolutely, there is a risk of breaking ribs. And I remember in one CPR training session, if you haven't broken the ribs, then you're probably not doing it the correct way. You're not compressing, deep enough. So there is a risk of breaking ribs. As far as I know, breaking ribs is not, ribs heal themselves, and saving the life is more important than breaking ribs. Ribs will heal. My own dad's ribs were completely broken when he had to have a bypass surgery. They have to break the ribs to get to the heart. So it's really it's possible. If they break, you are probably doing it the right way, and the ribs can heal.
Thank you, everyone, for listening until this session. And now we were collecting questions and answers through Q&A. Please put your questions so that we can make it interactive. I'll first, obviously, this is time to say a really good night to the students at James Cook University, Australia. It is well past midnight to them. Thank you for joining and your enthusiasm. Coming from the Eastern Zone, so we are very pleased to hear that from Shapna Chashi Group, as they were having one of the sustainability development camp going on, and in their conference, there are a few hundred people joined us today. A big cheers to all of you. And I hear they're also having a health camp running. So really a good job for them. From Bangladesh, big groups are coming also through SS Mahila College, as you all understand, in most parts of particularly Asia and Africa, where there is a significant concern both from the rescuers and from the victim's family that if the victim is a woman and if male rescuer is trying to give a chest compression, that may not be considered as appropriate. So here comes the role of our women folks, and I'm very delighted to see that SS Mahila College from Dhaka, SS Polytechnic Institute, and a scout group at Dirai, Bangladesh, along with Cyber Net Group. They are also performing and joining us today as a big group. In most parts of India, the most one, actually, I'm very delighted, Shramajivi Sasthu Udyog, with their biggest effort in the last couple of weeks, organizing many sessions around many schools and polyclinics, and recently took a huge initiative to put it on the Doctors Dialogue Group, which they were doing it for several years, of course, but more recently concentrated on the awareness of bystander CPR. I must mention many other groups in India, Himalayan Mountaineering Institute at Darjeeling. They are also joining us today in a big group. And Kharagpur, this particularly the big group which were working with St. John Ambulance over many, many years, are participating with us in many programs. And today they have organized quite a few sessions around parts of Bengal. Many other WhatsApp groups, particularly from eastern zones of India, have joined ISER Pune with their groups, and particularly young lady here, Ria Poddar, only 17, has already taken initiative to put it on her Instagram and other pages to take this awareness campaign in a different level. Really, I'm very, very indebted to all these people who are taking so much interest. And many parts I must mention about another big group in Mumbai. Dr. Madhav Sarted and his group is doing in a big way. Almost 500 schools has participated over the last few days, and next few days they are trying to take it to there. I'm very lucky to the groups I have mentioned. I could send some mannequins to all of them in different way, and they are making a good use of that. Coming out of India, both in Pakistan and Sri Lanka, several people have joined, and most parts of the Middle East, there are quite few groups have joined as well, from both in Iran and Turkey. A few people have concentrated there, and they are trying to organize in a bigger group. East Africa, both Uganda, Kenya, and Tanzania, here I must say, with a very significant interest of Dr. Ali Preptani, who is one of our faculty here, with his good connection there, as he was born in Uganda, and Cliff Aliga Ajima Velji in Uganda, and Anthony Batty and Dr. Judith Anumoanga in Uganda. They, with their Uganda Pediatric Association, is with us today. I'm very happy to see both from Kenya and Tanzania and Uganda, they are also planning to do in a big way in the coming weeks. And finally here, I must mention many of our colleagues from here in Canada is joining, and the big credit from my end to, I must say, Dr. Ramni Pineda from Mexico. She is joining with her group there. And I must give again, big thanks to Dr. Pineda for doing a transcript in Spanish. I offer an apology to Dr. Pineda that we originally thought that we will try to broadcast concurrently in Spanish translation subtitle along with this, but we found this will be technically challenged. So Dr. Pineda, we couldn't do that today, but definitely promise all these subtitles with particularly your kind interest and time. We are trying to publish it on our YouTube and Facebook also will try to put that as well. Regards to translation, we have translated this particular video in few more languages, where our friends from different parts, particularly in India, Rajat Dubey in Hindi and Smita Kora in Malayali and Priyanka Sarkar in Bengali have done this translation, and we're trying to put it in our YouTube page as well. So while we are waiting for this, and kindly tell me if there are any questions anyone wanted to ask, and I am more than happy to take individual questions. Please put any of the question answer sessions, and I'll try to take some of these individually. I might start with the commonest questions which are coming. Let me get what questions we have here. There is one question coming here, which obviously is many times we already have heard about this. And the most important question coming every time we are saying that the risk of injury. Everyone in the team is having this question that are we doing any harm? I know we addressed this already, but we are trying to talk on some of these questions again. I'm telling that the chest compressions, if we are doing it particularly well, there is no doubt that we will definitely cause an injury. Just, can you see this, my screen here? Can someone kindly confirm that you could see my screen or not?
No, we don't see a screen yet.
Okay. Give me 1 minute. Can you see now?
Yes. Yep.
Okay, so what we are trying to talk here, the same thing again and again is coming to all of us, that is there a risk of chest compression injury? No doubt, the deep chest compressions as the newer guidelines since 2010 coming up in the last almost 13 years, so that more studies are coming. Indeed, the chance of injury is increasing, as you were talking before. If you try to give deeper compression and more rates, the risk of injury, particularly rib fractures, are very, very common. But the good news is that our more important need here is to save a life, and we are seeing that chance of brain function actually is better when there are fractures in the ribs. And if you look at this study, clearly talking that those who had rib fracture, around 65% of patients, they have higher brain function compared to those who did not have chest injuries. The brain function is less. So we are obviously trying to do a balance here, and that definitely the chance of injury is there. And then the study further talks about another in the Lafayette University came out, especially as we are talking in the last 14 years, that members of the public in one hand increasingly came to the rescue with CPR as we are trying to promote the concept in most parts of the world. More and more people are taking interest and trying to do bystander CPR. That's the good news. And as a part of this, overall, their injuries of CPR are rising, which is essentially linked to the deeper compression and faster compressions. But these patients are having definitely better damage, less brain damage, and chance of improvement is higher. Then there was another question coming here as well. And this one we are talking here. There is a question earlier on, someone talked about epilepsy, that should we give these chest compressions or not, or do we know whether they're conscious or not? Yes, so as we heard this, that epilepsy, obviously, as you mentioned, that people are having epilepsy or seizures for our bystanders. So epilepsy is, of course, a medical term we use. Someone is having seizures, convulsions, and fits, like where the muscles are moving. So if the muscles are moving, basically they are having some form of this kind of tonic-clonic movement, and they are maybe frothing in the mouth. So that those are the groups where still there is blood circulation. So they do not need chest compression. They needed to be placed in the recovery position so that any secretions coming from their mouth may come down. That's possibly, we are talking about that. So that's one thing. So here, that if there are other signs of movement which confirms blood circulation in the body, then definitely we do not need chest compression at the time. They obviously still need to go to hospital. That's different. But we, as a bystander, when you're talking or watching here, they need to take the best thing here to put them in recovery and not going for cardiopulmonary resuscitation. There is a question here also in the chat box there, that is it good to go for chest compression even if a patient had bypass surgery? Yes, there is no question that even after bypass surgery, and you will be all interested to know that following any form of cardiac surgery in the hospital and while they're having immediate early post-operative period, the chance of cardiac arrest actually is another highest time, and the doctors they always have to give chest compression there. Of course, if the patient then is at home and years after, they still need the chest compression when done, when needed during cardiac arrest. And that is applicable for those who are having a pacemaker. That question sometimes comes as well. If there is a pacemaker, should we give the chest compression to them? Yes. And then ICD, the other more advanced kinds of things, which obviously works there. And that gives us the shock, which is something there we may not need. But even with pacemakers, we may need to do that. There is one question coming here that that we all talked about. Can you please tell us a little bit more about Good Samaritan law? So we talked a few times and there that for the bystanders, the world governing bodies have given us permission to go for chest compression at the time, and this is true both in US, where clearly says that the laws provides immunity from civil damage for personal injuries, even including death, that result from this kind of possible negligence if someone thinks. This is equally true that in Canada, a Good Samaritan law principle that prevents, basically protects the our volunteers success, and those if they helped a victim successfully and they cannot be sued from that. And it is the question obviously comes from where India is still not that popular. I'm sure in most parts of the low middle income countries where the chest compression, CPR, bystander CPR, all these are less commonly known. The questions are more, and that's why that we talk about that that the police should not involve the Good Samaritan, the volunteers, the bystanders for investigation, and Good Samaritans should be protected from civil and criminal liability, and Good Samaritans need not reveal their identity, and Good Samaritans can choose to be an eyewitness and should not be compelled otherwise. There is another question coming. So there is one question coming from Mr. Banerjee in India, that what should be in case of pregnancy and a victim's less than 1 year old? A great question. Definitely for pregnancy, it is equally applicable. Obviously, they needed more gentle care. If there is a cardiac arrest and if this happens, First, I must make it a bigger answer. If there is a pregnant lady who is falling unconscious, please remember it may not be a cardiac arrest. It may be a simple fainting, as we showed in our picture there. As during pregnancy, there is more chance of simple fainting. They may fall down, they may be dehydrated, they may have low blood pressure. So please check for the response first before you jump on doing this. So you do your due diligence, check for the responsiveness. But what we are talking, you have confirmed this person, this lady, really unresponsive, then definitely you need to think of that. You still give chest compression. But as you also mentioned, you do not want to press on the abdomen, the tummy. So you need to restrict yourself only on the chest, as our heart lies within the chest. And as we are talking every time, that this is, if you think about, this is the backbone and this is the top or the breastbone, and our heart is there. Our heart, which was gently pumping over our lifetime, always pumping blood to the body. Then now, at this time, if this heart is not contracting, then this is the chest compression going. So you have to give chest compression, even for the pregnant ladies, like anyone, but just focus that it should be only on the chest. And the injury to the fetus and the baby in the abdomen is higher here, of course, than any other abdominal injuries. Yes. And then talking about children, yes. And again, as our life starts, that when a baby is just born, coming out of the womb, that is one of the time, unfortunately, the doctors are often seeing. Of course, in many parts, including in Indian subcontinent, the train dies, and even in Africa, where the deliveries are not in the hospital, these personnel, they should be trained for these. That so when our life is studying a risk of not that heart pumping and not breathing is known. But children, particularly at birth, we have to give mouth-to-mouth breathing, as that possibly is the important stimuli, but definitely chest compression should be given there as well. There just one more question there coming, and just let me check. So I'm trying to answer the other question here. Sorry. The question is coming also about that why we are promoting chest compression only CPR, apart from the point of that people may hesitate. So different aspects to that. There is no question that before COVID time, already we came to know that chest compression only CPR may be as good, if not better at times, especially when it is happening during activities and the play field, and it is not a situation of swimming, drowning, or a baby. Their chest compression actually may have much better benefit. But the main reason is coordinating with not so skilled rescuer trying to coordinate with mouth to mouth in one hand, chest compression in other part. That might be the reason. But now we definitely clearly see that during COVID time, it became even more and more. And the hesitation here, and that is the most important point, that as there is a hesitation, people are waiting and they are not giving any form of resuscitation is more raised. And that's why we definitely need to talk about chest compression only CPR. And we have seen this particular study from Arizona that 18% actually were surviving if they are giving conventional ventilation, as opposed to when they are giving chest compression only, they find resuscitation, that definitely survival is even better. And the other interesting thing, they noted that overall the chance of bystanders participating is much higher. And this is very, very clear that when they see that these between 2005 to 2009, when the chest compression only CPR being introduced, there is a significant increase of the bystander participation in resuscitation. And I think that's possibly the most important reason people should think about chest compression only CPR for the not so skilled people. There is no doubt the skilled personnel, as they come out, they will take enough care and they will definitely start doing something more. And of course, we will talk about it at defibrillation as well. I think as you're looking, can anyone remind me, is there any more questions? I have one more question. Someone said about, yes.
Tapas, yes, there's two questions in the chat down there today in the Q&A.
Okay. So there is one question coming from Rakesh that if there's an AD close by, then should one proceed with CPR or use AD? So excellent question, and that's the reason I talked already in this, and this is the reason we need to talk more and more on every time. There is no doubt, any time this happens, even to get an AD, while you are starting an AD, to turn the AD on, the time we are missing, chest compression must be initiated by someone while other person is trying to work on AD. So answer is very clear. Even in the hospital, when we use the defibrillators, they are not AD, they are more bigger machine, and they're the defibrillators we are using. But we always start with chest compression. And once the machine is waiting to deliver the shock, and once it is done, again, we look at and we continue to do chest compression. So answer to the question is always continue chest compressions when a machine is getting ready and charged before the shock is given. And once the shock is given, again, we need to give chest compression. There is a question coming from a cybernetics robo group that that how should we keep performing CPR in case emergency services are late to arrive. So that's exactly we are talking that as a bystander, and the countries, as this is from Bangladesh. So most of the our countries in Asia and Africa, while we are at a disadvantage from many points, but the biggest advantage that most of our cardiac arrests are almost watched by the bystanders. So there are people. So what you are saying, answer is already there. Yes, you start doing and you continue doing. And here I didn't answer this, that there was a question coming as well, that if we are getting tired, what shall we do? And that's the answer, that every time when someone is giving a good chest compression, and if the victim size is really robust and big, the rescuer may find it very tiring. And so they may not continue for a long time. To give effective, good quality chest compression, possibly even you are reasonably active rescuer, a reasonably good built person, possibly you cannot continue more than 3-4 minutes. So the person should be ready on the other side. And as you feel you are getting tired, you give a call, tell the other person to continue, and you take some rest. And if there are more persons who can appropriately give chest compression, should take your position, and you can come back again. And until the skilled rescuer or you have taken the person to the hospital, you should continue it. Mr. Sohail Khan, also from Bangladesh, are talking here that there are a large number of students are organizing, and they are very benefited from this seminar. Thank you, Mr. Khan. I'm very happy that people are participating, but thanks to you that we could get more people to this forum and to talk about this. And I think that's possibly in this section. Oh, there is another question coming. Let me see whether I can go back to this. So now there is another question coming, that why you are talking about CPR at home. So there is a good things what I tried to answer. That let me skip this. So why do we talk CPR begins at home? That as most of the out-of-hospital cardiac arrest actually happening at home, even though we talked about that in the playground and activities, but statistically, percentage-wise, most of these arrests are happening at home. So in that way, CPR begins at home. And now we are, of course, many of us are learning CPR at home. So in both way, even literally, CPR begins at home. I just, if there are no other questions, kindly remind one of our students currently she's in Australia, and she did a CPR cartoon. I do not know whether this will be done. Just while you are watching, you can watch this video. It is in YouTube. Feel free to see.
Hi, so I'm CPR, and right now I'm at your home. I'm sitting right next to the fireplace comfortably. CPR begins at home. So, like I was saying, I can also be found wherever you go. So even if you're on the public transit, you can find me. CPR will be with you. So even if something happens at the workplace and you need my help, I will be there. CPR can be found at your workplace. Well, even if you attend a party, don't think I'm going to leave you. You can still find me at the party, sipping that nice coconut drink right beside you. It was a long day. We went to many different places, but I'm finally back home. So remember, wherever you go, you can find me.
I hope this was helpful. As I also, my apology if I haven't mentioned any particular big group, those who have joined. I know that many of you joined individually, and as this was also in Facebook live stream, many of you could not have your questions here, but we'll try to take some of the questions. Of course, many of the questions are very common to each of us, all of you, if you haven't done it, but I'm happy that many of you tried to have interaction and raised important questions.
There's one more in the Q&A.
Okay, thank you. So hi, Professor Dash, Nikhil, thank you for doing, oh yes, so this is, you are definitely, and I owe an apology for sure that I know that your group here, I forgot to mention that Science College, they organized also a big session in the past in the awareness part, and they were doing it, and Professor Shampagui also was helping to organize a big group here. Anyway, so Professor Das has a question for us, that how to get confirmed that the victim needs CPR, that is suffering a cardiac arrest, and what should be done for that by a bystander. So yes, so as you have seen in the very early slides, I may try to go back, but anyway, it may take some difficulty to go for me there. Anyway, but all of you, those who have watched, and this will be live streamed, so please go back in the very early on. I clearly mentioned, if a person responds, that response means they may raise hand and say, okay, or I'm feeling a bit dizzy, or I'm feeling lightheaded, whichever word they are using, or I'm having chest pain, abdominal pain, anything they mention, that means they are responsive. If they still cannot respond, or maybe a little bit down, but then you have to use maybe your knuckle, which then can be used on the middle of the chest bone, the breastbone, as we call the sternum. If you start giving a compression there, if you look at in this part, and that is a little bit painful stimuli, most people usually wake up and start moving at this time. And then you do not need to give chest compression CPR. But then also to remind all of you, which we put it in the video as well, it is possible at times that when you checked with just by asking questions or with the stimulation, people may not answer. And best thing as a bystander at this time is still to go ahead and start chest compressing, call for help, call for emergency to arrive. And if the person now starts moving, a chest compression itself is painful stimulus, or in that way, not stimulus, but a painful situation for them, they often works up. And I gave the example there that in many parts it has happened, and the person, the victim, wakes up and says, what's going on here? For sure. But all this can happen in different ways. The bottom line is, when you check for responses and people did not respond, as a bystander, please start doing chest compressions. And if immediately they start responding, let them stop and just watch and start talking to them and see what's going on, so that you can further help them or put them in recovery position. I hope that answers your questions. We are happy to stay long and take more questions, but please feel free. This will be there later in this one and still on the Facebook, but we'll try to publish some of these recordings with as many subtitles possible in different language. And if any further questions come from any of you, feel free to put it to us. If we assume there are no more questions, that we can stop today. Thanking you all. And we will definitely see you. We are doing this session once more in 2 hours time. And those who couldn't join and those who have more questions, and please feel free to join in the question answer session. Again, thank you everyone for joining us today. So I'm ending the session now with everyone's permission.